The day Elena Vasquez walked into the abandoned Millbrook Pharmacy with a cashier's check for $400, and her two skeptical children trailing behind her. Every healthcare professional in Oakridge Heights viewed it as a tragic waste of what little money she had. In a medical district where prestigious family practices span generations, and respect was earned through decades of pharmaceutical excellence, this former data analyst with no medical background clearly didn't understand what she was getting into. What these established medical professionals couldn't possibly know was that their biggest mistake wasn't doubting her commitment. It would be underestimating what she would discover hidden in that basement and how it would change everything. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow, I've saved something extra special for you, Mom. This place is kind of gross, 12-year-old Maya whispered, running her finger through a thick layer of dust coating the abandoned prescription counter. The fluorescent lights flickered overhead, casting eerie shadows across empty shelves that had once held life-saving medications. It has potential, Elena replied, her voice echoing in the cavernous space that smelled of disinfectant and neglect. Besides, for $100 for an entire building in this neighborhood, that's not an opportunity, that's a miracle. 10-year-old Diego pushed his glasses up his nose, inspecting a cobweb-covered blood pressure machine. But we don't know anything about running a pharmacy. Elena smiled at her practical son. I know data. I know healthcare systems. Sometimes the most valuable thing isn't the building or even the business, it's the information. She ruffled his hair. And sometimes, honey, when life closes every door, you have to find a window. Or in our case, buy one at a tax auction for less than the price of our old couch. The Millbrook Pharmacy had stood at the corner of Elm and Main for over 60 years, serving the Oakridge Heights community faithfully until Marcus Millbrook's sudden death 8 months ago. With no heirs interested in continuing the family business and mounting tax debts, the once respected establishment had fallen into disrepair. An eyesore in the otherwise pristine medical district, Elena pulled out her phone, snapping photos of the space while the children cautiously explored. Her former position as senior data analyst at HealthCore Solutions had given her a unique perspective on medical supply chains and pharmaceutical pricing models. When she lost that job in the economic upheaval following the pandemic, she'd spent months applying for positions that never materialized, watching her savings dwindle as potential employers questioned the 8-year gap in her resume the years she'd spent raising her children alone after her husband's death. The tax auction had been a desperate gamble, but as she surveyed the dusty shelves and outdated equipment, she saw possibilities that others had missed. The location was prime directly across from Oakridge Memorial Hospital and surrounded by medical offices. The building itself was structurally sound beneath the neglect, and if nothing else, it would give her somewhere to live while she figured out her next move. Mom, come look at this. Diego called from behind the counter. Elena found him pointing at a heavy metal door with an electronic keypad lock. I think it goes to the basement. Probably just storage, Elena said, though her analyst's mind was already cataloging possibilities. We'll need to call a locksmith too. I already tried the code, Maya interrupted, looking pleased with herself. 0 for 19. It was on that faded paper under the register. Elena raised an eyebrow. Maya, we can't just, it worked, her daughter said with a shrug. The light turned green, but the door's too heavy for me to pull open. Elena hesitated, then gripped the metal handle with a firm tug. The door swung open to reveal a concrete staircase descending into darkness. The musty smell of old paper and neglect wafted up from below. Stay up here, she instructed the children. Finding a light switch on the wall, ancient fluorescent tubes sputtered to life, illuminating a basement that seemed to serve as both storage area and private office. Metal shelving lined the walls, filled with dusty pharmaceutical reference books and faded cardboard boxes. A vintage desk occupied one corner, its surface covered with yellowed papers and what appeared to be research journals. But what immediately caught Elena's attention was the small safe bolted to the wall, its door slightly ajar. Mom, Maya called from the top of the stairs. What's down there? Just storage. Elena replied automatically. moving toward the safe. "I'll be up in a minute." Inside the safe, she found several manila folders, their edges worn with handling. The top folder was labeled with a simple heading, CDC Classified Phase 1 Findings. The date stamped below was from 5 years ago, 2 years before the pandemic that had upended the world. Elena's hands trembled slightly as she opened the folder. Her background in healthcare data analysis allowed her to understand the significance of what she was seeing: clinical trial data, early warning reports, correspondence between the CDC and several pharmaceutical companies, documents that raised disturbing questions about what had been known and when. "Ms. Vasquez?" The voice from upstairs startled her. Elena quickly returned the folders to the safe, closing it partially as she had found it, preparing and narrating. This story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. "Down here," she called, composing herself before climbing the stairs. Dr. Richard Harrington stood in the middle of the abandoned pharmacy, his expensive suit and carefully styled silver hair presenting a stark contrast to the dusty surroundings. At 62, he was the director of Oakridge Medical Associates, the largest practice in the district, and a third-generation physician whose family name adorned the hospital's east wing. "I see you've wasted no time exploring your investment," he said, making no effort to hide his skepticism. His gaze swept over the children before returning to Elena. "When I heard that Marcus's place had sold at auction, I must admit I expected a developer, not a single mother," Elena supplied, extending her hand. "Elena Vasquez, and these are my children, Maya and Diego." Harrington shook her hand briefly. "Richard Harrington. My practice is just down the block. Marcus and I were colleagues for many years. It's nice to meet you, Dr. Harrington. Were you looking for something specific? The place is pretty empty, but if there's something of Dr. Millbrook's you wanted, actually." Harrington interrupted. "I came to make you an offer. This building has potential. Despite its current condition, the location alone makes it valuable. I'd be willing to take it off your hands for, say, $50,000. A considerable profit on your $400 investment." The sum, more than Elena had in her bank account, was tempting, especially given her precarious financial situation, but her instincts, the same ones that had made her an exceptional analyst, told her there was more at stake. "That's very generous," she replied carefully, "but I'm not looking to sell. I have plans for this place." Harrington's expression hardened almost imperceptibly. "Plans? Ms. Vasquez, running a pharmacy requires licenses, pharmaceutical knowledge, significant capital investment. It's not something one jumps into without extensive background." "I'm aware of the requirements," Elena said, maintaining her composure. "But there are multiple ways to use this space within the healthcare sector, such as—" Harrington pressed. "I'd rather not discuss my business plans before they're finalized." Elena replied smoothly, "But I appreciate your interest." Harrington studied her for a moment, his expression unreadable. "Well, if you change your mind, my offer stands for now. Though I should warn you, abandoned buildings in the medical district become targets for code enforcement rather quickly. The renovation costs alone might prove prohibitive." The subtle threat wasn't lost on Elena. "I'll keep that in mind. Thank you for stopping by, Dr. Harrington." After he left, Maya perched on the edge of the dusty counter. "He seemed kind of pushy, Mom, and not very nice," Diego added, his young face serious behind his glasses. "Why would he offer so much money for this old place?" Elena considered how much to share with her children. Location is valuable in healthcare, just like in real estate, and sometimes people want things because they think someone else shouldn't have them. She glanced toward the basement door, thinking of the safe and its contents. Had Harrington known Marcus Millbrook well enough to be aware of what the pharmacist had hidden away? The offer seemed suspiciously generous for a building that had failed to attract any interest. At the public auction, "Are we really going to live here?" Diego asked, looking dubiously at the grimy surroundings. "Temporarily," Elena confirmed. "There's an apartment upstairs that needs cleaning, but it's included in what we bought. It'll save us rent money while we figure things out." "And what exactly are we figuring out?" Maya asked, her preteen skepticism in full force. You're not actually going to try to run a pharmacy, are you? Elena shook her head. Not in the traditional sense, but I do have some ideas. That evening, after the children had fallen asleep on air mattresses in what would become their temporary bedroom, Elena returned to the basement. With the documents spread across the old desk, she began to piece together what Marcus Millbrook had been involved with. The pharmacist appeared to have been part of a small group of healthcare professionals consulting on pandemic preparedness. The documents detailed early warnings about potential viral threats, including one that bore striking similarities to the pandemic that had eventually emerged. More disturbing were the communications suggesting that certain pharmaceutical companies had begun developing treatments well before the public had been informed of any threat treatments they would later patent and sell at enormous profit once the pandemic was in full swing. Among the papers, Elena found personal notes from Millbrook, expressing his growing concern about what he was witnessing. The final entry, dated just 2 weeks before his death, was particularly chilling. They're determined to suppress this information. Jay says there have been threats. I've made copies of everything and contacted P at the Times. If anything happens to me, the truth is in the safe. Elena's hands trembled as she carefully returned the documents to their folders. What had Marcus Millbrook discovered that might have cost him his life? And now that she possessed the same information, what danger had she inadvertently placed herself and her children in? A noise from upstairs startled her, setting the folders aside. Elena quickly climbed the stairs and found Maya standing in the dark pharmacy, staring out the front window. "Honey, you should be sleeping," Elena said, wrapping an arm around her daughter's shoulders. "There's a car," Maya replied quietly, pointing. "It's been parked across the street for hours. Someone's watching us." Elena peered through the dusty glass. Sure enough, a dark sedan was positioned with a clear view of the pharmacy entrance. Its windows tinted, the driver invisible. "It's probably nothing," Elena said, trying to sound more confident than she felt. "Let's get some sleep. We have a lot of work to do tomorrow." But as she led her daughter back upstairs, Elena knew their purchase of the old pharmacy had set something in motion, something potentially dangerous, whatever Marcus Millbrook had discovered. Others wanted it to remain hidden. Her mind raced, evaluating options, calculating risks as she had once analyzed healthcare data patterns. By morning, Elena had formulated the beginnings of a plan. After settling the children with cleaning supplies and clear instructions to stay upstairs, she made her way to Oakridge Memorial Hospital's administration offices. Her target was Sarah Chen, the hospital's director of community outreach, whose name she'd recognized from articles in the local paper. "I don't usually take meetings without an appointment," Sarah said, examining Elena's business card with a raised eyebrow. The card, hastily printed at an office supply store that morning, identified Elena as Healthcare Access Solutions Consultant. "I appreciate you making an exception," Elena replied. "I recently acquired the Millbrook Pharmacy building, and I have a proposal that might interest Oakridge Memorial." Sarah's professional demeanor softened slightly. "Marcus's place, that's been sitting empty for months. The hospital actually considered purchasing it, but the board decided against taking on another property at this time. That's exactly why I'm here," Elena explained. "I'm not looking to compete with established pharmacies. Instead, I'm proposing to convert the space into a healthcare navigation center, a place where patients can get help understanding their insurance options, medication assistance programs, and community health resources." Sarah leaned forward, clearly intrigued. "Go on." "Studies show that nearly 30% of prescriptions go unfilled because of cost concerns," Elena continued, drawing on her data analysis background. "Another 20% of patients don't follow treatment plans because they don't fully understand them. A navigation center could help address these gaps, improving outcomes while potentially reducing hospital readmissions." "And what's your background in this area?" Sarah asked. "I was a senior data analyst at Healthcare Solutions for 8 years," Elena replied. "I specialize in identifying inefficiencies in healthcare delivery systems and developing solutions to address them." "Healthcare, they do contract work for several major pharmaceutical companies, don't they?" "Yes. which gave me insight into how medication pricing works and how patients can access programs to make treatments more affordable. Sarah studied Elena for a moment. It's an interesting concept, but establishing something like this would require partnerships, funding. I'm not asking for funding, Elena interrupted. At least not yet. What I need is information on what resources are already available, where the gaps are, and potentially a letter of support from Oakridge Memorial that I can use when approaching other partners. That's quite reasonable, Sarah admitted, seeming surprised. I could provide some basic information and consider a letter of support once I see more detailed plans. Perfect, Elena said with a smile. I'm still getting settled, but I can have a formal proposal to you by next week. As Elena left the hospital, she felt a small surge of triumph. The meeting had gone better than expected, providing her with both legitimate cover for her presence in the medical district and potential allies who might prove valuable. As she continued investigating Millbrook's documents, her next stop was the local newspaper office, where she hoped to find P. at the Times, presumably the journalist Millbrook had contacted. Before his death, after some discreet inquiries, she identified Patricia Washington, a veteran healthcare reporter who had written several investigative pieces on pharmaceutical industry practices. I don't discuss sources or stories I may or may not be working on, Patricia said firmly when Elena approached her in the newspaper's lobby. I'm not asking you to, Elena assured her. I'm simply trying to understand more about Marcus Millbrook. I recently purchased his pharmacy building at auction. Patricia's expression changed subtly. Did you? That's interesting. Millbrook was well respected in the community. His death was unexpected. Heart attack, right? Elena asked, watching the reporter's reaction carefully. That's what the death certificate says, Patricia replied, her tone neutral but her eyes sharp. If you've purchased the pharmacy, I assume you've been through the building thoroughly. The question seemed loaded with meaning. I'm still exploring what I've acquired, Elena said carefully. If Marcus left anything behind that might be of interest to a journalist like yourself, I'd certainly want to make sure it reached the right hands. Patricia glanced around the lobby before handing Elena a business card. I'm usually at West Side. Coffee between 7 and 8 most mornings. If you find anything noteworthy, perhaps we could discuss it there. She paused, off the record. Of course. Elena agreed, tucking the card into her pocket. I appreciate your time. When Elena returned to the pharmacy, she found Maya and Diego had made surprising progress cleaning the upstairs apartment. The grimy windows now allowed sunlight to stream in, illuminating the simple two-bedroom space. Mom, look what we found, Diego exclaimed, pointing to a wall they had uncovered behind an old bookshelf. What had appeared to be ordinary wallpaper was actually dozens of newspaper clippings and printed articles, carefully arranged and annotated in Millbrook's neat handwriting. Elena examined the impromptu investigation board. The articles spanned several years, focusing on pandemic response planning, pharmaceutical company profits, and what appeared to be unexplained deaths of several healthcare professionals and scientists. Red strings connected certain articles, creating a web of relationships that Millbrook had apparently been tracking. What is all this? Maya asked, running her finger along one of the red strings. I think Dr. Millbrook was investigating something, Elena replied, her mind racing as she photographed the wall with her phone. Something important. Is that why that man in the fancy car is watching our building again? Diego asked, pointing toward the window. Elena looked out to see the same dark sedan from the night before, now parked half a block away but still with a clear view of the pharmacy entrance. I don't know, honey, but I think we need to be very careful about who we trust right now. That evening, after the children were occupied with unpacking their few belongings, Elena slipped back to the basement to continue examining Millbrook's documents. One folder contained what appeared to be financial records payments from several pharmaceutical companies to a shell corporation that Elena traced back to Dr. Richard Harrington. The amounts were substantial, labeled vaguely as consulting fees, but the timing corresponded with key decisions regarding pandemic response protocols. More disturbing were records suggesting that Harrington had been involved in early clinical trials of treatments that would later become standard protocols trials that had apparently shown concerning side effects that never made it into the published studies. A sudden noise from upstairs interrupted her investigation. Elena quickly returned the documents to the safe and hurried up the stairs to find Dr. Harrington standing in the middle of the pharmacy, examining the space with a critical eye. "Ms. Vasquez," he said, turning to face her, "I apologize for the intrusion. The door was unlocked." "It wasn't," Elena replied, certain she had secured it earlier. "How can I help you, Dr. Harrington?" "I've been thinking about our conversation," he said, his tone casual but his eyes alert, scanning the space as if searching for something. "I'd like to increase my offer to $75,000, cash. Of course, you could close tomorrow." "That's very generous," Elena said, maintaining her composure despite her racing heart. "But as I mentioned, I'm not interested in selling." Harrington's friendly demeanor slipped slightly. "Ms. Vasquez, I don't think you understand the challenges you're facing. This building has numerous code violations that would cost hundreds of thousands to address. The Medical Licensing Board is unlikely to approve any healthcare-related business here without significant renovations. I'm aware of the challenges," Elena replied evenly. "Are you?" Harrington stepped closer. Marcus Millbrook was a troubled man toward the end. His theories and accusations were symptomatic of declining mental health. "If he left behind any unprofessional materials, I'd be happy to dispose of them properly, as a courtesy to his memory." The thinly veiled inquiry confirmed Elena's suspicions. Harrington knew about the documents and wanted them. "I haven't found anything unusual," she lied. "Just an empty pharmacy that needs some care." Harrington studied her face, clearly searching for signs of deception. "Well, my offer remains open. But I should warn you, this medical district operates on relationships built over generations. Outsiders typically find it challenging to establish themselves here." After he left, Elena double-checked all the locks and drew the blinds. The encounter had shaken her more than she wanted to admit. Whatever was in those documents had powerful people concerned, enough to break into her building and offer substantial sums to recover them. That night, unable to sleep, Elena sat at her laptop reviewing the photographs she'd taken of Millbrook's documents and wall of connections. The picture emerging was disturbing, evidence suggesting that key pharmaceutical companies had advanced knowledge of the pandemic and had positioned themselves to profit enormously. Clinical trial data showing that cheaper, generic treatments had been sidelined in favor of more expensive patented options. And perhaps most disturbing, indications that certain healthcare professionals, including Dr. Harrington, had received substantial payments to promote specific treatment protocols. If authenticated and made public, these documents could trigger investigations, lawsuits, and possibly criminal charges. They could also potentially save lives if future pandemic responses were altered based on these revelations. But pursuing this would put Elena and her children at risk. She was a single mother with limited resources, up against powerful corporations and individuals with everything to lose. A soft knock at her door interrupted her thoughts. Maya stood in the doorway, her expression serious beyond her 12 years. "You found something bad in the basement, didn't you?" she asked quietly. "Something about the pandemic?" Elena hesitated, torn between protecting her daughter from harsh truths and respecting her perceptiveness. "I found documents that raised some questions," she finally acknowledged. "Dr. Millbrook seems to have been investigating some concerning practices." Maya sat beside her mother. "Is that why Dr. Harrington wants to buy this place so badly? And why someone's watching us?" "I think so. Yes. Are we in danger?" Elena put her arm around her daughter. "I don't know, but I'm going to make sure we're safe." What are you going to do with the information?" It was the question Elena had been wrestling with all night. "I'm still figuring that out." Maya was quiet for a moment. "Dad always said that doing the right thing isn't always easy, but it's always right." The mention of her late husband brought tears to Elena's eyes. "He did say that, didn't he? He also said you were the smartest, bravest person he knew," Maya added. "He said you could solve puzzles that would stump most people." Elena hugged her daughter tightly. "Thank you for reminding me of that." After Maya returned to bed, Elena made a decision. She couldn't walk away from what she had discovered. But she needed allies and a strategy. Tomorrow, she would meet with Patricia Washington at Westside Coffee and take the first step toward exposing the truth. What she couldn't know was that this decision would not only put her on a collision course with powerful interests in Oakridge Heights, but would ultimately transform her from an outsider to the catalyst for change in a community that had initially dismissed her as just another desperate single mother making a foolish investment. The dark sedan remained parked on the street all night, its presence a silent reminder that in purchasing a failed pharmacy for $400, Elena Vasquez had acquired far more than a building. She had stumbled upon secrets that some would kill to protect, and truths that might save countless lives if she found the courage to reveal them. The morning sun filtered through the newly cleaned windows of Millbrook Pharmacy. As Elena prepared for her meeting with Patricia Washington, she had spent most of the night organizing her findings, creating digital copies of key documents, and developing a strategy to protect both the information and her family. "I don't see why we can't come with you," Maya protested, watching her mother gather her materials. "We could sit at another table and just have hot chocolate." "It's too risky," Elena replied, securing a flash drive in her inner jacket pocket. "I need you both to stay here and continue setting up our living space. Diego, remember the code we practiced?" Her 10-year-old son nodded solemnly. "If anyone comes asking questions, I call Mrs. Chen at the hospital and say we need her too. Bring the papers for Aunt Patricia." Elena had carefully constructed this emergency protocol, knowing that Sarah Chen from the hospital might actually respond to such a cryptic message, especially after their promising meeting the day before. "Perfect," Elena said, kneeling to hug both children. "I won't be gone long. Keep the doors locked and stay upstairs." Westside Coffee was already bustling when Elena arrived. The morning crowd, a mix of hospital staff grabbing caffeine before their shifts and business people holding early meetings. Patricia Washington sat in a corner booth, her laptop open and two coffees on the table. "You came," the journalist observed as Elena slid into the seat across from her. "I wasn't sure you would." "Neither was I," Elena admitted. "But I think we need to talk about Marcus Millbrook." Patricia closed her laptop. "What exactly did you find in that old pharmacy?" "First, I need to understand something," Elena said, leaving the flash drive securely in her pocket. "Millbrook contacted you before he died, didn't he?" The journalist's expression remained neutral, but her eyes flickered briefly to the window. "What makes you say that?" "His notes mentioned contacting P at the Times. He was worried about threats he had received." Patricia sipped her coffee. Before responding, "Marcus reached out about 2 weeks before his death. Said he had documentation of serious ethical breaches related to pandemic preparedness and response. We were supposed to meet the day after he died. The official report said heart attack." Elena noted. 65-year-old man with no history of cardiac issues suddenly drops dead after threatening to expose pharmaceutical industry secrets. Patricia replied dryly, "I had questions, but no evidence to pursue them." "And now?" The journalist leaned forward. "That depends on what you found." Elena carefully described the contents of Millbrook's safe, watching Patricia's expression shift from professional interest to genuine alarm. "If authenticated, this could be the biggest healthcare scandal since the opioid crisis." Patricia said quietly, "You understand the risks in pursuing this?" "I'm beginning to," Elena replied, thinking of Harrington's thinly veiled threats and the mysterious car that had been watching her building. "But I also understand the risks of doing nothing." Patricia studied her thoughtfully. "Why are you doing this? You could have sold the building to Harrington, walked away with a nice profit, and avoided all this trouble." The question made Elena pause. Why indeed? Her children's financial security should be her priority. The easy path would be to take Harrington's money and walk away. "My husband was a high school science teacher," she finally said. "He died during the pandemic, not from the virus itself, but from a heart condition that went untreated because hospitals were overwhelmed. He couldn't get the care he needed when he needed it." She took a steadying breath. "If what I found is true, if certain parties had advanced knowledge and deliberately shaped the response to maximize profits rather than save lives, then people like my husband died unnecessarily. I can't walk away from that." Patricia nodded slowly. Publishing this kind of expose requires absolute certainty. We'd need irrefutable evidence, expert verification, and protective measures in place before going public. I understand, Elena said, finally sliding the flash drive across the table. This contains copies of everything I've found so far. I have the originals secure in another location. This was a strategic lie. The originals remained in the pharmacy safe. But Elena was learning to be cautious. I'll have my technical team authenticate these documents and consult with experts who can verify the scientific claims, Patricia promised, pocketing the drive. In the meantime, be careful. If Harrington or others suspect you've shared this information, the pressure will intensify. What should I do while you're verifying everything? Continue whatever legitimate business plans you've started for the pharmacy, Patricia advised. Maintain appearances and consider finding local allies, people with influence who might provide some protection if things escalate. As Elena walked back to the pharmacy, she noticed the dark sedan had moved to a new position, still maintaining surveillance. Rather than returning directly, she made an impulsive decision to visit the hospital again, this time heading to the community health clinic attached to the main building. The waiting room was crowded with patients, many clearly from lower-income backgrounds. Some looked confused as they filled out complicated forms. Others appeared resigned to the long wait ahead. "Excuse me," Elena approached the overwhelmed receptionist. "I was wondering if Dr. Gabriela Martinez is available." Dr. Martinez had been mentioned in Millbrook's notes as someone who had questioned the official pandemic treatment protocols, advocating for more accessible options for underserved communities. "Do you have an appointment?" the receptionist asked without looking up. "No, but I'm Elena Vasquez, the new owner of Millbrook Pharmacy. I'd like to discuss potential collaboration with the community clinic." This caught the receptionist's attention. "Millbrook's? That place has been closed for months." "Not anymore," Elena smiled. "Would you let Dr. Martinez know I'm here? I'll wait if she's busy." 20 minutes later, Elena found herself in a small office with a woman whose warm eyes contrasted sharply with her no-nonsense demeanor. At 50, Dr. Martinez had the confident presence of someone who had spent decades fighting for her patients against a system that often seemed designed to fail them. "So you bought Marcus's place," she said, studying Elena curiously. "He was a good man, one of the few pharmacists who would work with our uninsured patients to find affordable medication options. That's actually why I wanted to meet with you," Elena explained. "I'm developing a healthcare navigation center to help patients understand their options for affordable care and medications. The community clinic seems like a natural partner." Dr. Martinez's expression remained skeptical. "Noble idea, but what's your background in healthcare access?" Elena shared her history as a data analyst and her personal experience navigating the healthcare system after her husband's death. As she spoke, she carefully observed Dr. Martinez's reactions, looking for signs that the doctor might be a potential ally in her larger investigation. "The system is broken," Dr. Martinez acknowledged when Elena finished, "particularly for those without resources or knowledge to advocate for themselves." She leaned forward. "But turning a pharmacy into a navigation center requires more than good intentions. You'll face resistance from established interests who profit from the current confusion. People like Dr. Harrington," Elena suggested carefully. Something flickered in Dr. Martinez's eyes. "Harrington represents a certain approach to medicine, one that prioritizes specific metrics and relationships with industry partners. And you represent a different approach. I believe healthcare should serve patients, not shareholders," Dr. Martinez replied simply. Marcus shared that belief. His death was a significant loss for this community. The deliberate emphasis on Millbrook's death confirmed Elena's suspicion that Dr. Martinez had her own doubts about the official story. "I found some of Marcus's research materials in the pharmacy," Elena said cautiously. His perspectives on pandemic response were illuminating. Dr. Martinez grew very still. "Were they? I'd value your professional opinion on some of his conclusions, if you have time in the coming days." Their eyes met in a moment of mutual understanding. "My clinic hours end at 6 p.m. most evenings," Dr. Martinez said. but I sometimes make house calls for special consultations. The pharmacy apartment is still in disarray, but you'd be welcome any evening," Elena replied, writing her cell number on a business card. As she left the hospital, Elena felt a growing sense of purpose in Patricia Washington and possibly Dr. Martinez. She had found potential allies who shared her concerns about what Millbrook had uncovered. When she returned to the pharmacy, she found Maya and Diego had made remarkable progress organizing the main floor, clearing away years of dust and arranging the sparse furniture they'd brought from their previous apartment. "Mom," Diego called excitedly. "People have been coming by all morning asking when we're going to open." "Really?" Elena was surprised. "What kind of people?" "Mostly older folks," Maya explained. "They said Mr. Millbrook used to help them figure out which medications they could afford and which ones they could substitute with cheaper options. They were hoping you might do the same." The information confirmed what Dr. Martinez had said about Millbrook's role in the community. He hadn't been just a pharmacist, but an advocate for patients navigating a complex and often predatory healthcare system. "What did you tell them?" Elena asked. "That you were planning a healthcare navigation center to help people understand their options," Maya replied with a shrug. "Just like you told us." Elena smiled at her daughter's initiative. "And how did they respond?" "They seemed really excited," Diego chimed in. "One lady started crying. She said she's been taking half doses of her heart medication because she can't afford the full prescription." The reality of what this community needed struck Elena forcefully. While the documents in Millbrook's safe might eventually lead to systemic change, there were people suffering right now who couldn't wait for pharmaceutical industry reform. "I think we need to accelerate our plans," she decided. "Let's set up a basic information desk in the main area. We can provide information about patient assistance programs, generic alternatives, and local resources, all things I already know from my data analysis work." The children enthusiastically embraced the project, helping Elena create simple handouts and information packets. By late afternoon, they had transformed the dusty pharmacy counter into a welcoming help desk with clear signage. "Millbrook Healthcare Navigation Center, free consultation services." As they worked, Elena noticed the mysterious sedan had disappeared from its surveillance position. The temporary reprieve allowed her to focus fully on establishing their legitimate business presence in the community. "What about all that stuff in the basement?" Maya asked quietly when Diego was occupied with arranging brochures. "The secret files? I've shared them with someone who can help verify their authenticity," Elena explained. "For now, our job is to establish ourselves here while that process happens." "Is that why Dr. Harrington tried to buy us out? Because of those files?" Elena nodded. "I think so, yes." Maya considered this. "So we're kind of like undercover agents, right? Helping people while secretly investigating a conspiracy." Despite the seriousness of their situation, Elena had to smile at her daughter's framing. "Something like that. But the helping people part isn't a cover, it's equally important." "I know," Maya said. "That's what makes it a good plan. Dad would approve." The mention of her late husband sent a familiar pang through Elena's heart. David had been the idealist in their partnership, always believing that knowledge should serve the greater good. She had been the pragmatist, focused on practical applications and measurable outcomes. Together, they had balanced each other perfectly. Now, facing this unexpected challenge alone, Elena found herself channeling aspects of David's idealism alongside her own analytical approach. The combination felt right, as though he were still guiding her in some way. The next morning, their improvised navigation center received its first official visitors, an elderly couple struggling to afford their numerous prescriptions. "Millbrook always helped us find programs," the woman explained, clutching a plastic bag full of medication bottles. "Since he passed, we've been lost." Elena sat with them for nearly an hour, reviewing their medications and identifying several patient assistance programs they qualified for. She also noted potential generic substitutions they could discuss with their doctor. "You're an angel," the woman declared, tears in her eyes as she realized the potential savings. Just like Millbrook was, word spread quickly. By midday, a small line had formed outside the pharmacy, Most were elderly or clearly struggling financially. People for whom the Byzantine healthcare system presented nearly insurmountable obstacles. Elena worked tirelessly, drawing on her data analysis background to help each person find potential savings and assistance. Maya and Diego proved surprisingly helpful. Maya organizing the growing queue and intake forms, Diego keeping visitors comfortable with water, and his natural charm. Around 2 p.m., Elena looked up to find Dr. Harrington standing in the doorway, his expression dark as he surveyed the impromptu operation. "Ms. Vasquez," he said coldly, approaching the counter, "I wasn't aware you'd opened for business, do you? Have the proper permits for providing healthcare advice?" "We're not providing medical advice or dispensing medications," Elena replied calmly. "We're simply helping people navigate existing resources, something that doesn't require special licensing. Nevertheless, operating any healthcare-adjacent business requires proper registration with the District Medical Board," Harrington insisted. "I'd hate to see you face fines or closure for compliance issues." An elderly man waiting in line stood up shakily. "Now you listen here, Richard Harrington. This young lady helped me find a program that will save me $300 a month on my medication, something your fancy practice never bothered to tell me about. In 10 years of treatment," several others murmured, in agreement, forming a protective circle around Elena's makeshift desk. Harrington's face flushed with anger. "This is a matter of professional standards and community safety. This is a matter of you trying to shut down someone who's actually helping people," another voice interrupted. Elena was surprised to see Sarah Chen from the hospital standing just inside the entrance. The hospital's community outreach office fully supports Ms. Vasquez's navigation services. "In fact, we're exploring a formal partnership." The unexpected support from an established healthcare institution clearly caught Harrington off guard. "The hospital hasn't consulted with the District Medical Association about this," he objected. "We don't need to," Sarah replied smoothly. "Patient education services fall under the hospital's existing community benefit programs. Perhaps you'd like to take this up with the board." At the next meeting, the subtle reminder that several hospital board members outranked Harrington in the local medical hierarchy was effective. With a final warning glance at Elena, he departed, leaving a wave of triumphant murmurs in his wake. "Thank you," Elena said when Sarah approached the counter. "That was unexpected but very welcome support. I've been watching what you're doing." "Here," Sarah admitted, "when I heard Harrington was on his way to cause trouble, I thought you might need some institutional backing." She glanced around at the grateful clients. "This is exactly the kind of service our community needs. The proposal you mentioned in our meeting, I'm ready to review it whenever you are." The alliance with the hospital represented exactly the kind of local protection Patricia had advised Elena to secure. By embedding her navigation center within the community's legitimate needs, she was creating a fortress of public support that would make it harder for Harrington and his pharmaceutical allies to discredit or remove her. That evening, as Elena was closing up, Dr. Gabriela Martinez arrived, medical bag in hand as though making a house call. "Looks like you've been busy," she observed, noting the numerous intake forms and resource materials scattered across the counter. "The need was greater than I expected," Elena admitted, leading the doctor up to the apartment where the children were completing their homework. After introductions and sending Maya and Diego to their room with snacks, Elena retrieved key documents. "From the basement safe, Marcus showed me some of his concerns before he died," Dr. Martinez said quietly as she examined the papers. "But not all of this. The evidence of advanced knowledge is particularly disturbing." "Do you think it's authentic?" Elena asked. "The technical details align with what I observed clinically," the doctor confirmed. "During the height of the pandemic, I questioned why certain treatment protocols were being mandated over others that showed similar efficacy but cost a fraction of the price. When I raised these concerns, I was sidelined from key committees. Harrington was involved." Dr. Martinez nodded grimly. "He chairs the district's treatment protocol committee. Many of us suspected his pharmaceutical relationships influenced his decisions, but proving it was impossible until now, perhaps." "Patricia Washington is having the documents authenticated," Elena explained. "But I'm concerned about keeping the originals secure. Harrington has already tried to buy the building and threatened me with regulatory obstacles, and now you've become a community resource, making it harder for him to move against you without public backlash. Dr. Martinez observed with approval. Smart strategy. Not entirely strategic, Elena admitted. These people genuinely need help. The best cover is always genuine service, the doctor agreed. Marcus understood that. It's why he was beloved by patients, but a thorn in the side of the pharmaceutical representatives. As they continued discussing the documents, a soft knock at the apartment door startled them both. Elena cautiously approached, checking through the peephole to find Sarah Chen standing in the hallway, her expression urgent. "I'm sorry to disturb you at home," Sarah said when Elena opened the door, "but I thought you should know that Harrington has called an emergency meeting of the District Medical Association for tomorrow morning. The agenda includes a motion to condemn unlicensed healthcare operations in the district. He's moving quickly," Dr. Martinez noted, joining them. Sarah seemed surprised to find the clinic doctor there, but continued without comment. "The hospital administration is prepared to defend your operation as a patient education service, but Harrington has significant influence with private practitioners." "What do you suggest?" Elena asked. "Come to the meeting," Sarah advised. "Bring some of the people you've helped. Make it clear that you're addressing a critical gap in patient services, not competing with established medical providers." After Sarah left, Dr. Martinez helped Elena develop a strategy for the meeting. "Harrington is used to operating behind closed doors," the doctor explained. "Public scrutiny is his weakness. The more community voices supporting you, the harder it will be for him to shut you down." As they talked, Elena's phone chimed with a text message from Patricia. Documents appear genuine. Expert verification ongoing. Be careful, sources indicate. Increased interest in your activities from multiple parties. The warning was timely but vague. Who besides Harrington was taking an interest in her investigation? Were pharmaceutical companies already aware that Millbrook's documents had survived? "I should go," Dr. Martinez said, noting Elena's concerned expression. "You need rest before tomorrow's confrontation." After the doctor left, Elena checked on her sleeping children before returning to the basement for one final review of Millbrook's materials. As she sorted through the documents, a previously overlooked detail caught her attention: a reference to clinical trial data stored on an external hard drive. The safe contained no such drive, but Elena recalled the odd wall installation the children had discovered upstairs. Millbrook's conspiracy web of newspaper clippings and notes. With renewed purpose, she examined the wall carefully, looking for any hiding places. Behind a particularly dense cluster of articles about pharmaceutical company profits, she found a small cavity in the wall containing a weatherproof case. Inside was an external hard drive labeled simply "Backup," and a handwritten note in Millbrook's writing. "If you've found this, you already know too much to turn back. The password is first do no harm." Elena stared at the drive, understanding that she had just discovered an even deeper level of Millbrook's investigation. Whatever was on this drive had been important enough for the pharmacist to hide separately from his other documents. As she secured this new evidence in a different location, Elena reflected on how completely her life had transformed in just a few days. She had purchased a failing pharmacy hoping for a fresh start and found herself at the center of a potential healthcare scandal that could impact thousands of lives. The dark sedan had returned to its surveillance position outside. Harrington was mobilizing the medical establishment against her. Unknown corporate interests might already be aware of her discovery, and tomorrow she would face a formal challenge to her fledgling navigation center. Yet despite these mounting pressures, Elena felt more focused and purposeful than she had. Since losing her husband, the navigation center was already making a tangible difference in people's lives. The investigation into pandemic profiteering could potentially prevent similar exploitation and future health crises, and her children were showing remarkable resilience and maturity in adapting to their new circumstances. As she prepared for bed, Elena remembered something David used to say when facing seemingly insurmountable challenges. In his underfunded classroom, the size of your resources doesn't determine the size of your impact. It's what you do with what you have that matters. With Millbrook's documents, her data analysis skills, and growing community support, Elena had more resources than she'd initially realized. Tomorrow would bring its challenges, but for the first time since walking into the abandoned pharmacy, she felt confident that she had made the right decision in pursuing this path. What she couldn't yet know was how the coming confrontation with Harrington would transform her position in Oakridge Heights. From an outsider barely tolerated to a champion many would rally behind. The Oakridge Heights Medical Association headquarters occupied a stately brick building on Maple Avenue, its imposing facade reflecting generations of established medical authority. As Elena approached the entrance with Maya and Diego flanking her protectively, she noted the luxury vehicles filling the parking lot, a stark contrast to the modest cars and buses that had brought her impromptu coalition of supporters. Behind her walked 27 people whose lives had been directly improved by the navigation center in just 2 days of operation. Elderly couples who had discovered patient assistance programs, single parents who had found affordable alternatives to expensive medications, and chronically ill patients who had finally understood insurance coverage options they'd never been told about. Remember, Elena instructed her children quietly, no matter what happens in there, we've already helped these people. That's a victory no one can take away. Maya nodded solemnly while Diego gave her hand a reassuring squeeze. At 10 years old, his capacity for compassion sometimes startled Elena, a quality he'd inherited from his father that seemed to deepen rather than diminish with each hardship they faced. The meeting room fell silent as Elena and her unexpected entourage entered. Dr. Harrington sat at the head of a long mahogany table, surrounded by 15 physicians in white coats or expensive suits. His expression darkened as he registered the community members filing in behind Elena. This is a closed professional meeting, he announced sharply. Members of the public aren't permitted to attend. Actually, Sarah Chen interjected from her seat near the middle of the table. The association bylaws allow for public attendance at any meeting where community health services are being discussed. Since today's agenda specifically addresses a service being utilized by these community members, they have every right to be present. Dr. Martinez, already seated among the physicians, nodded in confirmation. Section 4, Paragraph 3 of the bylaws. Richard, we can provide a copy if needed. Elena guided her supporters to seats along the wall while keeping Maya and Diego close. The medical professionals shifted uncomfortably, clearly unaccustomed to having their discussions witnessed by those they served. Let's call this meeting to order, Harrington said stiffly. The primary agenda item concerns unlicensed healthcare operations, recently established at the former Millbrook Pharmacy location. Point of clarification, Sarah Chen interrupted. The Millbrook Healthcare Navigation Center provides educational services, not healthcare operations. This distinction is important for our discussion. Harrington's jaw tightened. Semantics aside, Ms. Vasquez has no medical credentials, yet is advising patients on healthcare decisions. I'm advising people on how to access existing resources and understand their options, Elena corrected, standing to address the room. I make it explicitly clear that all medical decisions should be made in consultation with qualified healthcare providers. Perhaps Ms. Vasquez should explain exactly what services she's providing, Dr. Martinez suggested reasonably. Elena nodded gratefully. The Navigation Center helps people understand their insurance coverage, identify patient assistance programs for medications, locate community health resources, and recognize potential lower-cost alternatives they can discuss with their doctors. We don't prescribe, diagnose, or make specific medical recommendations. And what qualifies you to provide even this level of guidance? Harrington challenged. 8 years as a senior data analyst at HealthCore Solutions, specializing in healthcare access and affordability metrics, Elena replied confidently. I've designed systems that identify barriers to care and optimize resource allocation. I understand the healthcare landscape from a systems perspective. Before Harrington could respond, an elderly man rose shakily from his seat along the wall. My name is George Williams. I've been Dr. Harrington's patient for 12 years. He held up an orange prescription bottle. This medication costs me $347 per month with my insurance. Yesterday, Ms. Vasquez helped me apply for a patient assistance program that will reduce my cost to $25. A murmur ran through the room as George continued. Dr. Harrington never once mentioned this program existed, despite knowing my fixed income. I've been cutting pills in half to make them last longer, putting my health at risk because I couldn't afford the full dosage. Another patient stood, and then another, each sharing similar stories of how the navigation center had helped them access resources no one had ever explained to them. This is precisely why hospital administration supports Ms. Vasquez's initiative, Sarah Chen added. When the testimonials concluded, our own data shows that medication non-compliance due to cost concerns is a leading cause of readmissions. The Navigation Center addresses a critical gap in our healthcare delivery system. Dr. Martinez leaned forward. I've reviewed Ms. Vasquez's materials and methods. They're accurate, appropriate, and potentially life-saving for patients struggling with healthcare costs. Far from condemning this service, I believe we should be formally supporting it. The mood in the room had shifted perceptibly. Several physicians, who had arrived prepared to support Harrington's motion, were now glancing uncomfortably at the community members, lining the walls, their own patients among them. Harrington, sensing his position weakening, changed tactics. While patient education is certainly valuable, there are serious concerns about the structural safety of the Millbrook building. As medical professionals, we cannot endorse services provided in a facility that may pose health risks. Elena had anticipated this angle. I've already scheduled a full inspection with the city's building department. In the meantime, we're primarily using the main floor, which has been thoroughly cleaned and presents no immediate safety concerns. Furthermore, Sarah added, Oakridge Memorial has offered temporary space in our community outreach office if any structural issues require remediation. Harrington's face flushed with barely contained anger. There are also questions about Ms. Vasquez's acquisition of the property and potential mishandling of sensitive materials that may have been left behind. The deliberate pivot toward Millbrook's documents sent a chill through Elena. Harrington was signaling that he knew exactly what she had found and was prepared to publicly question her handling of it. Dr. Millbrook's professional materials were properly secured, Elena replied carefully. Any confidential patient information has been protected in accordance with HIPAA regulations. I'm referring to research materials, Harrington pressed. Marcus was involved in certain investigational activities that may have resulted in questionable conclusions. Such materials could be dangerous if misinterpreted. Elena met his gaze directly. Are you suggesting Dr. Millbrook was engaged in improper research? I'm suggesting he became obsessed with conspiracy theories in his final months. Harrington replied smoothly. His mental state was deteriorating, a fact noted by several colleagues. Dr. Martinez straightened in her chair. That's simply untrue. Richard, I worked closely with Marcus until his death. His cognitive function was excellent, and his research methodologies were sound. You shared his peculiar views on certain pharmaceutical protocols. Harrington countered dismissively. I shared his commitment to evidence-based medicine and patient advocacy. Dr. Martinez corrected firmly. An older physician, whom Elena didn't recognize, cleared his throat. Perhaps we should return to the actual agenda item. Based on what we've heard, Ms. Vasquez's navigation services appear to be filling a legitimate need while staying within appropriate boundaries. I move that we table the motion to condemn and instead form a committee to explore potential collaboration. Seconded, said another doctor immediately. Harrington, recognizing defeat, called for a vote. The motion to table passed 13-2, with only Harrington and one close associate dissenting. As the meeting adjourned, Elena's supporters surrounded her with congratulations and gratitude. Several physicians approached as well, expressing interest in referring patients who needed help navigating financial assistance options. You handled that perfectly, Sarah Chen said, joining Elena as the room cleared. Harrington underestimated both you and the community's need for your services. He also tipped his hand regarding Millbrook's research. Dr. Martinez added in a lower voice. He's clearly concerned about what you might have found and willing to publicly question Millbrook's mental state to discredit it. Elena noted. Grimly, a desperate tactic, Dr. Martinez agreed, but effective if not challenged. As they exited the building, Elena spotted the now familiar dark sedan parked across the street. This time, however, she noticed something new: a second vehicle positioned at the far end of the lot, also with a clear view of the entrance. "We may have won this battle," she said quietly to Dr. Martinez, "but Harrington isn't the only one watching us now. All the more reason to move quickly with authenticating Millbrook's findings." The doctor replied, "Have you heard from Patricia? She's working with experts to verify the documents. I've also discovered additional materials that may contain even more significant evidence." Dr. Martinez's expression grew serious. "Be careful, Elena. If what Marcus discovered is as significant as it appears, powerful interests beyond Harrington will become involved." "I'm counting on it," Elena replied with determination. "The higher this goes, the more difficult it becomes to dismiss or cover up." Later that afternoon, as Elena and the children were helping patients at the Navigation Center, Patricia Washington arrived with a tall, distinguished man she introduced as Dr. Lawrence Evans, a former CDC epidemiologist now working as an independent consultant. "Is there somewhere we can speak privately?" Patricia asked. Elena led them to the basement office, leaving Maya in charge of the front desk with strict instructions to interrupt only for emergencies. "The documents are authentic," Dr. Evans confirmed once they were seated. "Internal communications, trial data, financial records, all consistent with CDC formatting and protocols from that period." "And the content?" Elena asked. "Disturbing, to say the least," the epidemiologist replied gravely. They confirmed that certain pharmaceutical companies had advanced knowledge of the pandemic threat and were developing targeted treatments months before public health officials issued any warnings, which explains the unprecedented speed of bringing those treatments to market, Patricia added. "They didn't develop them in record time, as claimed they had a significant head start. More concerning are the suppressed studies of alternative treatments," Dr. Evans continued. "Several generic options showed comparable efficacy in early trials, but were systematically sidelined in favor of patented alternatives that cost hundreds of times more." "And Harrington's involvement?" Elena asked. "Substantial," Patricia confirmed. "Financial records show he received over $3 million in consulting fees from 3 pharmaceutical companies during the critical period when treatment protocols were being established. His regional influence ensured these expensive protocols became standard practice across dozens of hospitals." Elena shared her discovery of the external hard drive, which she had hidden in a new secure location. "I haven't had a chance to examine the contents yet, but Millbrook clearly considered it important enough to hide separately. We should access it as soon as possible," Dr. Evans urged. "If it contains the raw trial data, I suspect it might. It could be the smoking gun that proves deliberate suppression of effective treatments." "What's our next step?" Elena asked. Patricia and Dr. Evans exchanged glances. "We need at least another week to complete our investigation," Patricia explained. "I've engaged cybersecurity experts to authenticate the digital materials and additional medical experts to review the clinical data. Meanwhile," Dr. Evans added, "your position here has become both more important and more precarious. The Navigation Center provides you with community protection, but as Harrington realizes he can't shut you down through official channels, he may resort to more direct tactics." As if confirming his warning, Elena's phone chimed with a text from Maya. "Mom, men in suits are here asking lots of questions. They say they're from the health department, but don't have badges." "Excuse me," Elena said, rushing upstairs to find 2 men in dark suits speaking with Maya at the front counter. Diego stood protectively beside his sister, his young face set in a suspicious frown. "Can I help you, gentlemen?" Elena asked, positioning herself between the men and her children. "Ms. Vasquez," the taller man inquired. "I'm Thomas Reed, and this is my colleague James Wilson. We're conducting a review of healthcare facilities in the district. May I see your identification?" Elena requested calmly. The men exchanged glances. "We're not conducting an official inspection today," Reed explained smoothly. "Just a preliminary assessment to determine which facilities require formal review. Then I'm afraid I'll have to ask you to schedule an appointment through proper channels," Elena replied firmly. "We're currently assisting patients and can't accommodate unscheduled interruptions." Wilson's eyes narrowed slightly. We understand you're operating without standard healthcare licensure. That raises certain regulatory concerns, as was clarified at this morning's Medical Association meeting. We provide educational services, not clinical care, Elena interrupted. If the health department has questions about our operation, I'm happy to address them through official channels. With proper documentation, the reference to the morning's meeting caught the men off guard. Reed recovered first. We'll be back with the appropriate paperwork, Ms. Vasquez. In the meantime, I suggest you ensure all your materials are properly secured and documented. The thinly veiled threat confirmed Elena's suspicion that these men weren't from the health department at all. As they departed, Patricia and Dr. Evans emerged from the basement, having overheard the exchange. Pharmaceutical company representatives, Dr. Evans guessed, watching through the window as the men drove away. Or possibly private security contractors. Either way, they're not government officials. How would they know about the documents? Elena wondered aloud. Harrington must have alerted his industry contacts, Patricia surmised, which means they're worried enough to send people to intimidate you directly. We need to accelerate our timeline, Dr. Evans decided. The longer we wait, the more pressure they'll apply. Elena looked at her children, who were watching the adults with worried expressions. I need to ensure Maya and Diego are safe first. These people have already shown they're willing to resort to intimidation. My sister lives in Westbrook, Patricia offered. It's about an hour away, far enough from Oakridge Heights to be safe but close enough for you to continue your work here. She has plenty of room and would be happy to host the children temporarily. Elena's instinct was to keep her family together, but the escalating situation demanded caution. After a private conversation with Maya and Diego, who displayed remarkable understanding of the seriousness of the situation, arrangements were made for them to stay with Patricia's sister for a few days. It's just until we sort things out, Elena assured them as she packed their overnight bags. Think of it as a mini vacation. We know, Mom, Maya said with precocious maturity. You need to finish what Dr. Millbrook started without worrying about us. And we'll be safer away from here, Diego added pragmatically. Those men were lying about being health inspectors. Their shoes were too expensive. Elena smiled despite her worry. When did you become such an observant detective? Dad always said you can tell a lot about people from their shoes, Diego replied, his expression momentarily sad at the mention of his father. He would want us to be smart about this. After Patricia departed with the children, Elena felt the emptiness of the pharmacy apartment acutely. The silence was both a relief and a burden, freedom to work without endangering her children, but separation from the two people who gave her life its greatest purpose. That evening, she retrieved the external hard drive from its hiding place and began examining its contents. What she found exceeded even her darkest suspicions. The drive contained not just raw clinical trial data, but video recordings of private meetings between pharmaceutical executives, regulatory officials, and key opinion leaders in medicine, including Harrington. In these unguarded moments, they discussed strategies for maximizing profits during the coming pandemic, debated which physicians could be incentivized to support specific protocols, and calculated the potential revenue from treatments still in development. Most disturbing was a spreadsheet titled Cost-Benefit Analysis that explicitly compared the profitability of various treatment approaches against projected mortality rates. Treatments that might save more lives but generate less profit were systematically deprioritized. One executive was recorded saying, "A pandemic is a terrible thing to waste. This is our opportunity to establish pricing models that will benefit shareholders for decades." Elena worked through the night, organizing the materials and preparing secure copies. By morning, she had compiled a comprehensive dossier that Patricia could use for her expose. The evidence was irrefutable, a paper trail of corruption, profiteering, and callous disregard for public health that had shaped the pandemic response and cost countless lives. As dawn broke, Elena finally allowed herself a moment of quiet reflection. The path forward was clear but fraught with danger. Go in public with this information would trigger an unprecedented scandal and likely invite retaliation from those implicated. Yet failing to act would betray not only Marcus Millbrook's sacrifice, but also the memory of Elena's husband and all those who had suffered unnecessarily due to these corrupt practices. A soft knock at the pharmacy door startled her from her thoughts. Through the blinds, she recognized Sarah Chen's silhouette and cautiously let her in. "I apologize for coming so early," Sarah said, her expression tense. "But I've just learned something you need to know immediately. The hospital received a notice last night that Harrington has filed for an emergency injunction to seal all contents of the Millbrook property, pending an investigation into potentially dangerous medical misinformation." "Can he do that?" Elena asked, alarm rising. "He's claiming that as a senior medical authority, he has reason to believe Millbrook was collecting and distributing harmful medical conspiracy theories. The judge who received the petition is his brother-in-law. When will this happen?" "The hearing is scheduled for 2 p.m. today. If granted, they could have enforcement officers here by late afternoon." Elena's mind raced. "So I have just hours to secure everything." "Less than that," Sarah warned. "Word from a hospital board member is that Harrington doesn't plan to wait for the official order. He's already arranged for a safety inspection of the building at noon, with a team that will likely attempt to access any secured areas." "Why are you telling me this?" Elena asked, studying Sarah carefully. "You're risking your position at the hospital." Sarah's expression hardened. "Because my brother died during the pandemic, after being prescribed one of those overpriced treatments Harrington championed. The hospital's financial assistance program that should have covered his medication was mysteriously unavailable for that particular drug. By the time we realized, it was too late." The personal revelation transformed Sarah from a professional ally to someone with her own stake in exposing the truth. "I've suspected for years that the pandemic response was compromised by financial interests," she continued. "If you have evidence, I want to help ensure it reaches the public." Elena made a rapid decision. "I need to get these materials to Patricia Washington immediately, and I'll need help creating multiple secure backups. I have a contact in the hospital's IT department who can help with the backups," Sarah offered. "And my car is outside if you need transportation." For the next several hours, Elena worked frantically with Sarah and Dr. Martinez, who arrived shortly after hearing about the impending inspection. They created secure digital copies of all documents, distributing them among trusted allies with instructions to release everything to selected media outlets if anything happened to Elena, or if the original materials were seized. Patricia arrived mid-morning, bringing news that her editor had agreed to publish their expose as a major investigative feature, but needed 48 more hours to complete legal review. "We need to stall Harrington's team," Elena decided. "Buy enough time for Patricia's story to break." "I can help with that," Dr. Martinez volunteered. "As a senior physician, I can challenge their authority to inspect medical facilities without proper documentation. It won't stop them completely, but it could delay them significantly." At exactly noon, as predicted, 3 men in official-looking uniforms arrived, claiming to represent the building safety department. Dr. Martinez met them at the door, demanding to see their credentials and specific inspection orders. Standard procedure requires 24 hours notice for non-emergency inspections, she informed them crisply, blocking their entry. "I'll need to see the emergency declaration that authorizes this exception." While Dr. Martinez engaged in procedural combat with the inspection team, Elena used the distraction to transfer the most critical physical evidence to Patricia's car. Sarah, meanwhile, had arranged for several navigation center patients to arrive simultaneously, creating a crowd that made discreet searching impossible. The inspectors, frustrated by the obstacles and witnesses, eventually departed with threats to return with police enforcement. Elena knew they had gained only hours at most. "We need to consider that they might succeed in seizing the property," Patricia warned once they were alone. "Is there anything else here that could be damaging if found?" Elena thought of the wall of connections in the apartment and Millbrook's original notes in the basement. "Yes, and I can't fully remove it without destroying evidence. Then perhaps we need to ensure the evidence is documented before they can tamper with it," Sarah suggested. "I know several hospital board members who might be persuaded to witness and document the current state of the property. By mid-afternoon, Elena had assembled an impressive group of witnesses, 3 hospital board members, a representative from the State Medical Ethics Committee whom Dr. Martinez had called, and 2 respected community physicians who had been impressed by the Navigation Center's impact. "This is an unusual request," admitted Dr. Eleanor Richards, the Ethics Committee representative. "But given the serious nature of your concerns about potential evidence tampering, we're willing to conduct a thorough documentation process." For the next 2 hours, the group methodically photographed, cataloged, and witnessed every aspect of Millbrook's research materials still on the property. Each person signed attestations confirming what they had observed, creating a chain of evidence that would be difficult to dismiss. "This won't prevent them from seizing the property," Dr. Richards explained, "but it establishes that any materials found in a different condition later have potentially been tampered with." As the documentation process concluded, Elena's phone rang with a call from Patricia. The judge granted Harrington's injunction. The journalist reported grimly, "They'll be there within the hour with enforcement officers to seal the building and all its contents. We're as prepared as we can be," Elena replied. Surveying the now documented evidence and knowing that multiple copies existed in secure locations. "What about your story? My editor is expediting the legal review. We're aiming to publish first thing tomorrow morning, assuming no last-minute issues." Elena thanked her witnesses as they departed, leaving her alone in the pharmacy. That had become both her home and the center of an impending healthcare scandal. The Navigation Center desk, with its informational pamphlets and sign-in sheets, stood as a reminder of the genuine good they had already accomplished. As she waited for the authorities to arrive, Elena was surprised to find herself feeling not fear but a profound sense of purpose. In purchasing this failed pharmacy for $400, she had stumbled upon an opportunity to make a difference far beyond what she could have imagined. Her data analysis skills, once applied to optimizing healthcare systems, were now being used to expose fundamental corruption within those same systems. She thought of Maya and Diego, safe at Patricia's sister's home, and of her late husband who had always believed in standing up for truth. The path she had chosen was dangerous, but it honored his memory and taught their children the value of courage in the face of powerful opposition. When 3 police officers and Dr. Harrington finally arrived at the pharmacy door, Elena met them with calm resolve. "Elena Vasquez," the lead officer asked, "I have a court order to seal these premises and all contents pending investigation." "I understand," Elena replied, stepping aside to allow them entry. "I've been expecting you." Harrington, who had clearly anticipated resistance, looked suspicious at her cooperation. All materials related to Marcus Millbrook's research must remain undisturbed. He instructed the officers, particularly any documents or electronic storage devices. "Of course," Elena agreed mildly, "though you should know that representatives from the State Medical Ethics Committee and the Hospital Board have already documented the current state of all materials on the property. Any alterations would be immediately apparent." Harrington's expression darkened as he realized the implications. His plan to seize and potentially alter or destroy incriminating evidence had been effectively countered. "This building is now under seal," the officer announced after posting the official notice. "No one is permitted to enter without court authorization." As Elena gathered her personal belongings, Harrington approached her with barely contained fury. "This isn't over. Ms. Vasquez, whatever you think you've discovered, whatever you think you know, it won't matter. Some fights can't be won by outsiders." Elena met his gaze steadily. "That's where you're wrong. Dr. Harrington, I may have arrived as an outsider, but I'm not one anymore. This community has shown me that truth and justice still matter here. Despite your best efforts." Leaving the pharmacy that had briefly been her home, Elena felt a strange mixture of loss and anticipation. She had lost her physical space, but gained something far more valuable, a purpose that connected her to a community and honored her family's values. What she couldn't know as she walked away from the sealed building was how completely the coming days would transform not just her own life, but the landscape of healthcare in Oakridge Heights and beyond. The documents she had discovered in that $400 pharmacy were about to ignite a reckoning that would shake the foundations of the medical establishment and redefine her place within it. The dawn light filtered through the curtains of Sarah Chen's guest bedroom as Elena scrolled through her phone, watching as the world reacted to Patricia Washington's explosive expose. The headline dominated every news site: pandemic profiteering. Leaked documents reveal pharmaceutical companies had advanced knowledge, suppressed affordable treatments. Patricia had delivered a masterpiece of investigative journalism. The article methodically detailed how key pharmaceutical companies had received early warnings about the coming pandemic, developed treatments months before public health alerts were issued, and systematically buried research on generic alternatives that could have saved countless lives at a fraction of the cost. The story named names: corporate executives, regulatory officials who later took lucrative industry positions, and influential physicians like Dr. Richard Harrington, who had received millions in consulting fees while promoting expensive treatment protocols. Most damning were the verbatim quotes from the recorded meetings, where executives coldly calculated profit margins against projected death tolls. Elena's phone buzzed constantly with notifications. National news networks were picking up the story. Medical ethics experts were calling for congressional investigations. Pharmaceutical company stocks were plummeting in pre-market trading, and social media had erupted with outrage as people connected their personal pandemic losses to the deliberate profiteering exposed in the article. "You've started an earthquake," Sarah observed, bringing Elena a cup of coffee as she joined her at the kitchen table. The hospital board called an emergency meeting for 9 a.m. Half the medical community is in panic mode. "Any word from Harrington?" Elena asked. His office issued a statement claiming the documents were fabricated and threatening legal action against the Times. "But it's a weak defense. Too many people have verified the authenticity of the evidence." Elena checked her messages from Patricia, who reported that the newspaper's website had crashed twice due to unprecedented traffic. Television news crews were gathering outside the sealed Millbrook Pharmacy, and 3 national networks had requested interviews with Elena. "What about Maya and Diego?" Sarah asked. "They're safe and apparently enjoying their adventure." Elena replied with a small smile. "Patricia's sister says they've been following the news coverage and are very proud of their mom." The healthcare detective, despite her exhaustion after days of intense pressure, Elena felt a profound sense of vindication. Marcus Millbrook's courageous work had not been in vain. The truth he had died protecting was finally reaching the public. By mid-morning, the first official responses began rolling in. The governor announced the formation of a special task force to investigate the allegations. The state medical board issued an emergency suspension of Harrington's license pending investigation. And most surprisingly, 2 pharmaceutical company executives named in the expose had resigned, issuing carefully worded statements about stepping aside while the company addresses these concerning allegations. At noon, Elena received a call from Judge Michael Foster, who had signed the order sealing the pharmacy. "Ms. Vasquez, I'm calling to inform you that I've reversed my previous order. The seals on the Millbrook property will be removed immediately." "May I ask what prompted this reversal?" Elena inquired, knowing that Foster was Harrington's brother-in-law. A heavy sigh came through the line. "Let's just say I've recused myself from any further proceedings related to this matter, due to previously undisclosed conflicts of interest. The evidence presented in today's news reports raises questions that require impartial judicial review." Translation: the judge was distancing himself from his connection to Harrington as quickly as possible. "Thank you for informing me," Elena replied, maintaining her professional tone despite the surge of triumph she felt. By early afternoon, Elena had assembled her core allies: Patricia, Dr. Martinez, Sarah, and Dr. Evans at Sarah's home to discuss next steps. The unfolding scandal had exceeded even their expectations, with new revelations emerging hourly as more people came forward with corroborating evidence. "The pharmaceutical industry is in full damage control mode," Patricia reported. "My sources say they're already preparing settlement offers for potential class action lawsuits. The more important question is how this will affect future pandemic preparedness and response." Dr. Evans noted, "Exposing past corruption is valuable, but preventing its recurrence is essential." Elena had been considering this exact issue. What if the navigation center evolved into something more comprehensive? Not just helping patients navigate existing systems, but advocating for transparency and accountability in healthcare decision-making? A watchdog organization with community roots, Sarah mused. It could monitor treatment protocols, pricing practices, conflict of interest disclosures, and provide education on healthcare rights and options. Dr. Martinez added, "Many of my patients still don't understand how to evaluate treatment recommendations or question potential conflicts of interest as they discussed possibilities." Elena's phone rang with a call from an unknown number. Elena Vasquez speaking. She answered cautiously. "Ms. Vasquez, this is Caroline Blackwell, chairperson of the Oakridge Memorial Hospital Board." The voice was crisp and authoritative. "I'm calling to request a meeting with you at your earliest convenience. The board has some proposals we'd like to discuss regarding your navigation center and the future of healthcare transparency in our community." Elena raised her eyebrows at her companions as she replied, "I'd be happy to meet with the board." "Ms. Blackwell, when did you have in mind? Would 4 p.m. today be possible? We're convening a special session to address the revelations in this morning's news." After agreeing to the meeting, Elena hung up and shared the development with her allies. "Seems the hospital board wants to get ahead of this story," she observed. "Caroline Blackwell is a formidable woman," Sarah noted. "She's been pushing for greater transparency in hospital operations for years, often against significant resistance from Harrington's faction. Having her reach out directly is a positive sign." As Elena prepared for the meeting, retrieving her files from the now unsealed pharmacy and changing into her most professional outfit, she reflected on the extraordinary chain of events that had led to this moment. What had begun as a desperate purchase of a failed pharmacy for $400 had evolved into a catalyst for potentially transformative change in healthcare practices. The Oakridge Memorial Hospital board room was imposing, a wood-paneled chamber with portraits of past medical directors lining the walls. 14 board members sat around a massive table, their expressions ranging from curiosity to concern as Elena entered. Caroline Blackwell, a striking woman in her 60s with silver hair and penetrating eyes, rose to greet her. "Ms. Vasquez, thank you for joining us on such short notice. Please have a seat." She gestured to a chair positioned at the head of the table, a subtle but significant indication of respect. "The board has called this emergency session to address the serious allegations published this morning regarding pandemic treatment protocols and potential conflicts of interest involving medical leadership in our community." Blackwell began formally. "As you are central to bringing these matters to light, we felt it essential to include you in our deliberations." Elena nodded, maintaining her composure despite the intimidating setting. "I appreciate the invitation. My goal has always been to improve healthcare access and transparency for patients, a goal that aligns with the hospital's mission despite recent deviations," Blackwell replied, her tone making it clear where she stood on the allegations. "We've spent the morning reviewing both the published reports and additional materials provided by Dr. Martinez and Sarah Chen." One of the older board members leaned forward. "Ms. Vasquez, can you tell us what you envision as the path forward from here? Beyond exposing past wrongdoing, what constructive changes might address the systemic issues you've identified?" The question was an opening invitation to shape the hospital's response rather than merely react to it. Elena had prepared for this moment, developing a comprehensive vision that expanded far beyond her initial navigation center concept. "I believe we have an opportunity to establish Oakridge as a national model for healthcare transparency and patient advocacy," she began, outlining her proposal for an independent healthcare accountability institute that would combine direct patient services with systemic monitoring and reform initiatives. For nearly an hour, Elena presented her vision while answering increasingly engaged questions from board members rather than defensiveness. She encountered growing enthusiasm as the board recognized the potential to transform a damaging scandal into a distinguishing commitment to ethical healthcare delivery. "What this community needs," Elena concluded, "isn't just accountability for past mistakes, but a new framework that makes such abuses much more difficult in the future." Patients deserve advocates with both the expertise to understand complex healthcare systems and the independence to challenge those systems when necessary. When she finished, Caroline Blackwell surveyed the room, noting the positive responses from her colleagues. I believe we have a consensus that Ms. Vasquez's proposal merits serious consideration. I suggest we form a working group to develop implementation plans, with Ms. Vasquez as a key consultant. Another board member, the CFO of a local manufacturing company, raised his hand. I'd go further. My company would be willing to provide initial funding for this Healthcare Accountability Institute. As part of our community benefit program, I suspect other local businesses would join us, particularly those concerned about healthcare costs for their employees. By the meeting's end, what had begun as crisis management had transformed into an opportunity for institutional reinvention. The board voted unanimously to support the development of Elena's proposed institute, with dedicated space on the hospital campus and an independent governance structure to ensure its autonomy. As Elena left the meeting, Caroline Blackwell walked her to the elevator. "You've accomplished something remarkable, Ms. Vasquez," she said quietly. "Not just exposing corruption, but offering a constructive path forward. That's far rarer and more valuable." "Thank you," Elena replied, still processing the meeting's unexpected outcomes. "But I didn't do it alone. Marcus Millbrook deserves the primary credit for documenting the evidence. I just helped bring it to light. Don't underestimate your contribution," Blackwell advised. "Many people encounter evidence of wrongdoing. Few have the courage and vision to act on it effectively." She pressed the elevator button. "By the way, the board has also voted to establish a Marcus Millbrook Memorial Scholarship for ethical pharmaceutical practices. We believe his legacy should be honored." The acknowledgement of Millbrook's sacrifice brought tears to Elena's eyes. "He would have appreciated that. He truly cared about his patients, as do you," Blackwell observed. "The Navigation Center has already helped dozens of community members in just a few days of operation. That practical impact, combined with the systemic reforms you're now catalyzing, represents healthcare advocacy at its best." The following day brought a whirlwind of developments. National media descended on Oakridge Heights, transforming the small medical community into the epicenter of a burgeoning healthcare scandal. Elena gave carefully prepared interviews, focusing on the systemic issues rather than personal attacks on Harrington or others implicated in the documents. "This isn't about individuals," she explained to a CNN reporter. "It's about a system that prioritizes profit over patient well-being and the structural changes needed to rebalance those priorities." By evening, congressional hearings had been announced to investigate pandemic profiteering. 3 major pharmaceutical companies had issued statements promising internal reviews and enhanced transparency measures, and the state attorney general had launched a criminal investigation into potential fraud, conspiracy, and corruption related to pandemic treatment protocols. Throughout this public storm, Elena maintained her focus on the Navigation Center's daily operations, which continued to serve a growing stream of community members seeking help with healthcare access and affordability. The practical work of guiding patients through complex systems grounded her amid the media frenzy and policy debates. A week after Patricia's expose broke, Elena finally felt secure enough to bring Maya and Diego home to the pharmacy apartment. The children had become minor celebrities at school, where their classmates regarded them with a mixture of awe and curiosity. "Jamie Peters asked if you're going to be on the cover of Time magazine," Diego reported as they unpacked their overnight bags. "I told him probably not, but you should be." Elena laughed, delighted to have her children home. "I'd rather focus on helping people navigate healthcare than being on magazine covers." "But you're already doing both," Maya pointed out, showing her mother a national news website featuring Elena's photo beside the headline. "Healthcare whistleblower proposes revolutionary patient advocacy model." "The important thing," Elena emphasized, "is that we're making a difference. Remember how this all started? With a $400 purchase at a tax auction that most people thought was foolish." "Dad would have loved this," Diego said quietly. "He always said you were the smartest person he knew." Elena hugged her son close. He would have been proud of both of you too. The way you've handled all this change and uncertainty with such courage. That evening, as the children settled back into their rooms, Elena took a moment to visit the basement office where she had first discovered Millbrook's documents. The space felt different now, no longer secretive and ominous, but historically significant. The birthplace of a movement for healthcare transparency that was gaining national momentum. On the desk lay a letter that had arrived that morning from the executor of Marcus Millbrook's estate. It explained that Millbrook had left specific instructions regarding the pharmacy property. In the event that the documents I've compiled reach the public through legitimate channels, ownership of the building should be permanently transferred to whoever facilitated that public disclosure, with the hope that they will continue using it to serve the community's healthcare needs. The letter confirmed that the executor was now processing the legal transfer of the property to Elena, free and clear of any encumbrances. What had been a temporary refuge purchased in desperation was becoming a permanent home and headquarters for her expanding vision. A knock at the pharmacy's front door interrupted her reflections. Elena climbed the stairs to find Dr. Martinez waiting with several other physicians from the community. "We hope we're not intruding," Dr. Martinez said, "but we wanted to speak with you about something important." Elena welcomed them into the main area, where the navigation center desk stood as a symbol of her initial community outreach. "We've been meeting those of us who share your concerns about healthcare transparency and affordability," Dr. Martinez explained, "and we'd like to formally affiliate with your Healthcare Accountability Institute initiative." One of the other physicians, a young neurologist named Dr. James Wilson, elaborated. "What you've started here resonates with many of us who entered medicine to help people, but have found ourselves increasingly constrained by systems that prioritize profit over care. We're proposing a network of affiliated physicians committed to transparent practices," added Dr. Sofia Rodriguez, a family medicine specialist. "No hidden financial relationships with pharmaceutical companies. Clear communication about treatment options including costs, and active participation in developing ethical care guidelines." The proposal represented exactly the kind of systemic change Elena had hoped might eventually emerge from her initiative. Healthcare providers themselves embracing transparency and accountability as core values rather than externally imposed requirements. "This is exactly what the Institute was designed to facilitate," Elena replied warmly. "Creating a community of practice around ethical healthcare delivery could transform patient experiences far more effectively than any regulatory approach alone." As they discussed implementation details, Elena marveled at how quickly her influence had grown. Just weeks ago, she had been an unemployed single mother desperate enough to gamble for $100 on an abandoned pharmacy. Now she was partnering with hospital board members, physicians, and community leaders to reshape healthcare practices at both local and potentially national levels. The following morning brought another unexpected visitor to the pharmacy. George Williams, the elderly patient who had spoken up at the medical association meeting about cutting his expensive medications in half. "Ms. Vasquez," he greeted her with a warm handshake. "I've been talking with some folks at the senior center about what you've been doing here, and we have a proposition for you." George explained that many seniors in the community had been deeply affected by the pandemic, both medically and financially. Many had lost spouses or friends, while others had depleted retirement savings on overpriced treatments now revealed to have been part of the profiteering scheme. "We'd like to form a patient advisory council for your institute," he proposed. "People who've experienced these challenges firsthand, advising on priorities and keeping your work grounded in real community needs." "That's an excellent idea," Elena replied enthusiastically. "The institute should be guided by patient perspectives, not just professional opinions." George beamed. "We've already got 15 people ready to participate. Turns out a lot of folks have been waiting for someone to finally listen to their healthcare struggles." The organic growth of community support around Elena's initiative continued to surprise and move her. What had begun as her personal quest for justice had resonated with a community hungry for healthcare reform and eager to participate in creating solutions. By the 1-month anniversary of Patricia's expose, The landscape of healthcare in Oakridge Heights had transformed dramatically. Harrington was facing multiple investigations and had resigned from all of his medical leadership positions. The hospital had implemented comprehensive conflict of interest disclosure requirements for all affiliated physicians, and Elena's Healthcare Accountability Institute had secured formal nonprofit status, substantial funding commitments, and a growing network of affiliated healthcare providers committed to transparency principles. The pharmacy building now officially. Elena's property had been renovated to serve as both the family's home and the Institute's headquarters. The Navigation Center continued operating on the main floor, now with a staff of trained advocates helping community members access affordable care options. The basement had been converted into a research center where data analysts, including several former colleagues Elena had recruited, tracked healthcare pricing, treatment outcomes, and potential conflicts of interest across the region. On a warm Saturday morning, Elena stood on the pharmacy steps watching as workers installed the new sign, Millbrook Institute for Healthcare Accountability and Transparency. She had insisted on keeping Millbrook's name prominent, honoring the pharmacist, whose courage had made everything possible. Maya joined her, slipping her hand into her mother's. "It doesn't even look like the same place anymore," she observed, taking in the renovated facade and professional signage. "In many ways, it isn't," Elena agreed. "Just like we're not the same people who arrived here with nothing but hope and desperation." Diego emerged from inside, proudly wearing a t-shirt with the Institute's logo, a stylized lighthouse beam cutting through fog, symbolizing the clarity and guidance the organization aimed to provide. "Mom, Dr. Martinez just called. She says CNN wants to interview you about the congressional hearings next week, and the governor's office left a message about appointing you to the State Healthcare Transparency Commission." Elena smiled at her son's excitement. "Tell them I'll call back after our family picnic. Today is for us." The three of them had planned a celebratory outing to mark both the Institute's official opening and their 1-month anniversary in Oakridge Heights. So much had changed in those few weeks that it felt important to pause and acknowledge the journey together. As they prepared to leave, Caroline Blackwell arrived with a small delegation from the hospital board, carrying a framed certificate. "We couldn't miss the official opening," she explained. "The hospital wanted to present this formal recognition of your contributions to healthcare in our community." The certificate acknowledged the transformative impact of Elena Vasquez's advocacy for healthcare transparency and patient rights. It was signed by every board member and included a quote that particularly touched Elena. "Some see things as they are and ask why. Others dream things that never were and ask why not." "Thank you," Elena said, genuinely moved by the recognition. "But this has truly been a community achievement. I just happened to be the person who found the documents and refused to look away." "It takes special courage to stand alone against established power," Blackwell replied, "and even rarer wisdom to transform that stand into a movement others can join. You've done both." As the board members departed, Elena looked at her children, Maya's thoughtful confidence and Diego's compassionate enthusiasm. Both seemed to have flourished during their time in Oakridge Heights. The challenges they had faced together had strengthened them individually and as a family. "Ready for our picnic?" she asked, locking the pharmacy door behind them. "More than ready," Maya replied with a smile. "We've earned it." Walking toward the community park, Elena reflected on the extraordinary journey that had brought them here. What had begun as a desperate for $100 investment in a failed pharmacy had yielded returns beyond anything she could have imagined, not just in material terms, but in purpose, community, and impact. The document she had found in Millbrook's safe had changed the course of healthcare policy and potentially saved countless lives by exposing corruption and creating accountability. But more personally, they had given her family a new beginning, one built on courage, integrity, and service rather than compromise and survival. As they spread their blanket under a sprawling oak tree, Elena watched her children laughing together while unpacking the picnic basket. The path forward would undoubtedly bring new challenges. The pharmaceutical companies implicated in the scandal had vast resources and would fight to protect their interests. The structural changes needed in healthcare systems would face resistance from those profiting from the status quo. But Elena no longer faced these challenges alone or from a position of vulnerability. She had built a coalition of allies, earned the respect of the community, and created an institutional framework to sustain the work beyond any individual effort. A young woman approached their picnic blanket somewhat hesitantly. "Excuse me, are you Elena Vasquez?" Elena nodded, expecting perhaps another media inquiry. "I just wanted to thank you," the woman said, her voice catching slightly. "My mother was prescribed one of those overpriced pandemic treatments. We couldn't afford it, even with insurance. After your expose, her doctor switched her to one of the alternatives that had been suppressed. It's working just as well and costs a tenth as much." She paused, collecting herself. "You saved my mother's life and our family's financial future." After the woman left, Diego looked at his mother with undisguised pride. "See, that's why what you did matters so much." "What we did," Elena corrected gently. "I couldn't have done any of this without you and Maya supporting me every step of the way." As the afternoon sun filtered through the oak leaves above them, Elena felt a profound sense of fulfillment. The journey from outsider to community catalyst had been neither easy nor safe, but it had been unquestionably right, honoring both Marcus Millbrook's sacrifice and her late husband's belief in standing for truth, regardless of the cost. What had begun in that basement safe with classified CDC documents had blossomed into something far greater, a movement for transparency that was already saving lives and transforming a community's approach to healthcare. The failed pharmacy purchased for $400 had become the unlikely birthplace of a healthcare revolution that promised to spread far beyond Oakridge Heights. Maya leaned against her mother's shoulder, watching people walking by, many of whom now nodded in recognition or offered warm smiles to the family they had initially dismissed as outsiders. "Mom," she asked quietly, "are you glad we bought that pharmacy, even with all the danger and trouble it brought?" Elena looked at her daughter, seeing the growing wisdom in her young face. "Absolutely. Sometimes the greatest opportunities come disguised as impossible challenges. The key is having the courage to face them and the wisdom to recognize when something matters more than your own comfort or safety." Diego looked up from the sandwich he was eating. "Like Dad used to say, the size of your impact isn't determined by the size of your resources, but by the size of your courage." Elena smiled at her son's perfect recall of her late husband's words. "Exactly. And that $400 pharmacy turned out to be the best investment we could have possibly made, not because of what it was, but because of what it allowed us to become." As the afternoon drifted toward evening, the Vasquez family remained in the park, celebrating not just their new beginning, but the profound truth that one person's courage, combined with unwavering integrity and strategic action, could indeed change systems that many had believed were too powerful to challenge. The failed pharmacy that had once represented Elena's desperate last hope had become a beacon of healthcare accountability that would ultimately impact countless lives, all because she had refused to look away when confronted with uncomfortable truths and had found the strength to stand firm when powerful interests tried to silence her. In purchasing that abandoned building for $400, Elena Vasquez had acquired far more than a physical property. She had discovered her purpose, reclaimed her power, and created a legacy that would continue transforming healthcare long after the initial scandal faded from headlines, a legacy built on the simple, revolutionary principle that patients deserve advocates as committed to their well-being as those pursuing profit. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.